Good afternoon, everyone. We might just get started. And welcome to this session on community housing providers in the disability housing market. So I'll just read that out. Hello there. A bit louder. I'll come a bit closer to this. So just make sure you're in the right session. That would be fantastic. And we'll get started. So to start with, I'd like to respectfully acknowledge the traditional owners of the lands that we're on today and the Wurundjeri people where we are here of the Kulin Nations, and also send out our respects for the people that are online as well from various different lands across Australia, and acknowledge elders past, present and emerging. So thank you for joining our session. My name's Alecia Rathbone and I'm the General Manager of Social Enterprise at the Summer Foundation. And we're really involved in the disability housing market because our organisation wants to solve the issue of younger people having to live in residential aged care because there's nowhere else to go. And so housing is just a key part of that strategy for us. And so the work I do is very much working with housing providers around a tool called the Housing Hub, and you might have seen some of our team are out at the lunch area where we provide a service like a realestate.com, but it's for accessible housing across Australia, and that's free for providers and people with disability to use. And so some of the work we do is really around looking at the market data in the sector and working with those in the sector to understand that. So what we're going to do today is just have a quick presentation to set the scene. I don't want to be talking too much. We really want this to be a great discussion, and we've got our experts here who I'll introduce you to who can be part of that conversation, and especially everyone here also submitting those questions via the app that I think people would be familiar with by now, and also people online can also submit questions. And most of the time we want to be a discussion about how is this sector emerging, what's going on for us, what are the challenges and what are the opportunities here that we can all see. So that's the point of today. So to get us started, I wanted to pose a question to you. So how are the community housing providers and this sector meeting the needs of people with disability? So maybe if you want to just take 30 seconds, have a think about this and have a bit of a share with your neighbour, just a bit of a chat to start thinking about this, and hopefully this will also spark some ideas for some questions we might have during the discussion. And if you're online, please also have a think about that yourself. So let's just have 30 seconds, have a chat to someone next to you. All right, I hope everyone's had a quick moment to have a think about that. We'll all just come back together now. Thank you. Thanks, everyone. We'll get started. Okay, so we'll start off with a brief introduction to disability housing in Australia. I know that not everyone necessarily will be involved in this space, and that's why you're coming along. So just to start with some definitions, so really around a disability is defined by the Australian Network on Disability as being a condition that restricts a person's mental, sensory or mobility functions. It may be caused by an accident, trauma, genetics or disease, and it can be temporary, permanent, total, partial, lifelong, acquired or visible and invisible, which is something we've just been talking about down the front. Accessible housing properties are those that have certain features that mean that people can use those throughout their life while they're transitioning in old age, as well as having a disability, and around 1 in 6 or 18% of Australians have a disability. As of the 31st of December 2021, there's about 500,000 people who are on the NDIS and supported through that scheme. And 1 year prior to that, the NDIS had released their home and living consultation, and in that consultation they suggested that there's over 76,000 people out of that 500,000 who have a goal in their plan about where they live. So you can see that it's a really growing area of people with disability exploring their housing options and exercising choice and control. And just finally on here, I would just mention around the accessible housing designs are codified through Livable Housing Australia, and with those different levels of accreditation, so being from silver to platinum, and they've also come in through the SDA that we'll talk about shortly. Also mentioned too with what I said before about the Housing Hub, so at the moment right now today there's over 1,900 accessible properties across the country that are being advertised as having vacancies, so lots more happening around properties available for people with disability. In terms of SDA, or specialist disability accommodation, just a very quick overview because this is something we explored in the research survey that I want to share with you today. So it is housing for people who have an extreme functional impairment or very high support needs. And so that's for a really small number of people within the NDIS who are participants. So when we think about that 500,000 being all of the participants, only about 30,000 people will actually be eligible for SDA funding. So it's really important to remember when we do talk about SDA, it is for a small portion of people who have a disability. It was introduced in 2016 when the NDIS was introduced and has been progressively rolled out throughout states across the country. And it can be different types of properties. So you can see apartments or houses, group homes, villas and townhouses, and it can be for one person to live on their own or with their family, but it can all be all the way up to five people or more living together. But any new properties that are built are for 5 people or less. In terms of the SDA market, just a couple of points here just to set the scene before we get into the survey data. So there's currently 16,972 NDIS participants who have SDA funding in their plans. So that's the latest data that we have access to, which was from December. And at the same time, there's currently over 18,900 places available for people with SDA funding. And it's important to note that many of those places that are available, we would estimate that to be about 14,000 in older type housing stock. So some of the housing that existed before 2016 was able to be counted as SDA. So that's something we're looking at around the new build properties versus the older properties. But also if you look at those supply and demand figures, you can really see that right now there's a much more supply than demand. And that's certainly something that when we get to the survey will come out, and I'm sure it'll come out in our discussions as well as one of the challenges. So moving on to the community housing providers in the market. So as of June 30, 2019, there were over 500 community housing providers across Australia, according to the Australian Institute of Health and Welfare, and that we see over 437,000 social housing dwellings, and the majority being public housing. I'm sure this is information that everyone here is very aware of all the time. But what's important here in setting the scene is when we think about how CHPs have come into the sector and what that role is, it's been a different role that different community housing providers have decided to take. So some providers have decided to come in as developers and use that expertise. Some have come in to manage properties using that expertise, and quite a number as well have registered as a provider but aren't actually providing any SDA as yet. So a lot of people still in the whole market and this subset still contemplating about SDA. This graph here is just from another piece of our research. As I mentioned before, we do a lot of different reports. So this is from our SDA Supply in Australia report that we've been doing for a number of years. And I can see Robin here, who started this when she worked in our organisation. So hi, Robin. This also looks at the whole market, and what's interesting to note here is for community housing providers, they're just representing 11.3% of who participated in this research at the end of last year, and you can really see who's coming into the SDA market being those for-profit housing providers and a lot of not-for-profit disability organisations as well. So it's always quite interesting to see what the mix of people coming into this new market is. So getting on to this survey that we did, so Summer Foundation carried out this survey of community housing providers during the month of February, so just gone. It's something we're still writing up at the moment, and a full report will come out and be available to everyone in the coming months, I would say, probably 1 to 2 months from now. And so we contacted PowerHousing and Chia's members through PowerHousing and Chia, and we worked together to create the survey, and then also invited everyone to be part of that. And we had 68 responses, as you can see there. And from the 68 responses, 26 providers said that they are providing some form of accessible housing within the market, and 13 of those are SDA providers. So it gave us a bit of a view of both SDA and non-SDA housing. And what was really interesting was collectively this group, when they reported to us how many places that they're managing, it represents 13% of the whole market of SDA places available, which is actually a really good portion to start to look at. It was also $324 million worth of capital that was represented through the people in the survey. So we won't go through all of the information. Of course, we'll send that out in the report, but we've just pulled out some key pieces for you so this can be a bit of a conversation starter when we get to the main part of the discussion. So the average percentage of SDA properties that CHPs were providing ranged from 1% to 31% of the total stock, and the average was about 6.7 of their stock that was reported. And one of the things I would say, looking at all of the data types, and when you look at the graph there on the right, when you look at the ranges, we definitely saw a really, really large range. And so there wasn't necessarily a real consistency where we could actually say, oh, a lot of community housing providers are doing similar things. Actually, what it said to us is people are doing different things. So when it comes down to design categories or the types of properties, there were lots of variation. We also saw the location on the left there where things are being provided. So we had SDA reported in every state and territory except for the ACT through this group. And consistent with our other research, the robust design category had the least amount of properties being developed or being offered. So that's really similar to what we see in our other research in the NDIA data and a lot of discussion within the sector. And the most reported dwelling type was a group home in this. Okay, so we also wanted to ask about non-SDA housing. So that's really important, and it's often a theme in these discussions, that what happens to the 94% of NDIS participants who need some sort of accessible housing but aren't necessarily going to be getting SDA funding. So we wanted to explore there about those Livable Housing Australia guidelines to understand how people are applying those. So this showed us with the guidelines that there's, again, that range is really up and down. So there's a wide range of providers. So some providers said 100% of their non-SDA properties were meeting the guidelines, and some said 0. And you can see from the graph that there's quite a difference across those. And I guess the key data point too here is on average 70% of non-SDA dwellings were not meeting the LHA guidelines from what was reported through to us. So that's quite a lot actually. Yeah, and I think when we were having some discussions about, what people are living with disability in housing without those accessible features, that can be quite challenging. We also wanted to explore what was the impact of the National Construction Code, which changed recently. So on the 30th of April, a majority of the building ministers, and you can see that in yellow on the slide, have agreed to change those the minimum standards. So this is amazing opportunity in terms of the community and people ageing in place. And the majority of providers who we surveyed here actually said to us that they think it will have a positive impact upon their organisations, with only 12% saying that it might have more cost or more effort implications. So that's been really good to see. We also wanted to test confidence in the market and then move on to challenges and opportunities, which is what we wanted this session to be about. So in terms of looking at the confidence in the market, these questions are really similar questions to what we survey across the entire SDA cohort. So we're able to compare that and have a look at what is the whole market saying versus this subset, which will be in our report that we publish. But with confidence, there was about 50% of the respondents said that they were very or slightly unconfident in the market, with only 25% saying that they are confident. And so this is something we're starting to see, especially over the last 18 months, an emerging trend where people are saying they're losing some confidence in the market for various reasons. So we did some thematic analysis on a question to understand why do people give that answer about either being confident or unconfident. So the most reported theme of concern that came up was a lack of market stewardship by the NDIA. And that was a whole range of issues. So things about unclear policy, unclear eligibility, the timeframes for decisions to be made for people to move in, and transparency about those funding decisions. Also, demand data came up again as something that often comes up from providers. The second theme was around the lack of activation of demand by the NDIA, so causing vacancy risks. So not able to find tenants, not able to find people who have SDA funding. And then the impact of COVID-19 also came up as a theme for providers, particularly around property development, but also the impact that's having on vacancy rates. So the full report will include much more data on this, including that comparison to the whole market based on our other reports. So moving on to the pipeline. So we didn't ask these providers to give us their pipeline again because they've already provided it in that report we had last year in November, December. So there's just some data here around those 6 providers who did have a pipeline The key points are really only half of them are saying they're definitely going to keep going, half said they weren't sure, and that might be a reflection of the confidence we've just discussed. But there's still quite a lot of places, when you look at those number of places, 663 that are being reported as being developed, you can definitely see that the community housing sector is still very much in that development space. So moving on to opportunities, we wanted to know, what's the positive outlook as well. There's still a lot of opportunity here. And so again, we asked a question around, do you see other opportunities for CHPs in the area of disability housing that you'd like to mention? And looked at the themes coming out of that. So definitely one of the key themes was we need more of a focus for non-SDA eligible people. So where are the homes for the 94%? It's really important. And the other theme was very much about, as CHPs, we have unique skills that we could be bringing into this market and we could be using in different ways, but also thinking about the good outcomes we could have for tenants. So to summarise some of those points, I know I went through that very quick, but I do want the main part to be the discussion. The average percentage of SDA properties for CHPs who are SDA providers and reported to us was 1 to 31%, with the average being 6.7% of their stock. 70% of non-SDA dwellings were not meeting the LHA guidelines, and the most reported design categories were basic and high physical support. We had talked about mixed confidence, and we talked about some of the opportunities that are being seen. Before we finish, I just was asked, and we had a discussion before this, to make sure we're thinking about the tenant voice. So I think for what we do at the Housing Hub, it's very much about tenants and people with disability being at the centre of that. And a lot of the data we're collecting is about how we can provide that information to the market. So tenants' views are starting to shape what gets developed. And so just a note on some of the data reports that are available if you're thinking about being in this space. They're freely available on the Housing Hub website, and we look at housing seekers' needs and preferences. And so this is just one graph from a recent report we had in December. And this is about the SDA design category that people are saying that they're looking for. And we've now got data around what people are searching for. So this data for 6 months was over 80,000 searches on the Housing Hub looking for different types of properties, compared to profile data, which is where people make a login and tell us what sort of home they want to find, and then the website will send people suggested properties. And then also the NDIA have an emerging data set that's coming through now with some people that have SDA in their plan and they know are looking. So there's about 2,500 people in that data set. So we're able to then start to compare. And I think what's interesting when you look at the three there is actually that there are some things really in common, even though some of them are really large data sets and some of them are smaller. So quite a lot of people that need high physical support or are searching for high physical support still. But with the NDIA data, a lot more people who have been assessed as improved livability as being their housing need, whereas maybe that's not what everyone's looking for as much on our website and telling us that they need. Great. And we've got a little infographic we can send out at the end with some of those key data points that will come through, and of course the final report that will come as well. And now we want to get on to the panel discussion, because that's why we're all here. So I just wanted to introduce you to our panel, which we're delighted to have a range of experts here today to answer our questions and share that information. So first of all, we've got Nicholas Proud, who's the CEO of PowerHousing Australia. And PowerHousing facilitates a national network of 36 growth and Tier 1 regulated community housing providers who develop and manage affordable housing across Australia. So welcome to Nick. We've also got Wendy Hayhurst, who's the CEO of the Community Housing Industry Association, or CHIA as we all call it, the peak body representing not-for-profit community organisations across Australia. And we have Charles Northcote, who is the CEO of BlueCHP, which is one of the leading providers of SDA in this emerging market, and particularly as a community housing provider, which is what our focus is on today. So we're hoping we'll get lots of audience questions. I'm going to go and get onto the iPad now and see those coming through. So please do get them typed in. But to get us started, we thought we'd just ask Nick and Wendy to set the scene a little bit around CHP's involvement in disability housing. So Wendy's going to go first for us, and we've actually got a slide here from Wendy with some of the data that you're going to talk about. So thanks, Wendy.
Thanks, and good afternoon, everyone. I'm just starting off with a bit more data because the survey that we did was quite focused on SDA, quite rightly. And we want this discussion to be about more than specialist disability accommodation. I think it's great that there's funding for that programme, but it has created a bit of an artificial divide, and I find that I go to a lot of sessions and we do talk about SDA and the viability of that, and then forget about the other 93%. The first statistic that I put up there is from a recent consultation that the NDIA did, An Ordinary Life at Home, and they talked there about the numbers of people who are receiving are participating in the NDIS who also have a housing issue in their plan, so housing that's unsuitable or unaffordable, and that's 17.6% of people. And I'll just put my specs on and read out how many that is. That's over 76,000 people with disability receiving money from the NDIS, but no assistance from housing at the moment. So that's a large number of people that we need to understand more about what it is that they need in terms of housing and how our sector can help. The second point I wanted to get across is that, of course, CHOs, community housing organisations, regardless of whether they're registered as providers of specialist disability accommodation, are already housing lots and lots of people with disability. So even though a number of the organisations that responded to the survey said they weren't in the business, in a sense, all community housing organisations are in the business of providing housing for people with disability. So data isn't brilliant, but taking AIHW's Housing Assistance 2021, we know that at least 30% of households in community housing have at least one family member with a disability there. So that's almost a third. I suspect it's a lot larger than that. The other thing we need, we know, and we do want to get a tenant voice in this as well, is that people with disability, regardless of whether they're living in public housing or community housing, are generally less satisfied with their house, the location, the amenity, and the service that they get than people or households that don't have a disability. And that could be for a whole range of reasons, but that's a stat that we don't want to see lower down. So we know there are more things to do there on services as well. And we also know out there, just going back to what data we can get, and it's the report on government services, and we know there can be issues with that. But when we look at the number of households, again, with a person with disability, we know that they're disproportionately receiving Commonwealth rental assistance, which is great. But as you can see there, that doesn't mean those people aren't already, some of those people are still in rental stress after receiving that. So what we know as community housing organisations is that we are working with people with disability. We can do more in terms of how we respond on services. But boy, there's an issue out there about whether or not we can get the resources to actually work with people with disability to provide a lot more accommodation. Thanks.
Thanks, Wendy. Thanks, Wendy. I don't know if this is working. Is it working? No. Okay. We'll see if we can get it to work. Nick, did you want to go next in terms of your views?
I think I can. It's not working yet.
No. Okay.
Use mine.
Yep, well, we've all hugged each other today, so if you haven't, get ready for it. In all seriousness, the world is an unusual place, and the situation we find ourselves in today is not what we expected 3 months ago. And I think what's really important is that we're here together in person and people shaking hands, and something we're just not used to doing. But I think what's really powerful about this gathering today is that whatever your last conversation was will influence your next. Hopefully not with groupthink, but with a consensus, a view that we've got a problem. And I think with the problem we're facing is that we're not actually taking serious responsibility as a country for our housing. I mean, those numbers are startling, and I think they're worse than that. I think there's a lot fewer homes that are livable in this country, and I know that because I'm a board member of Livable Housing Australia. I've been a board member for 8 years. I can tell you now there has been a market failure in a dismal way there. I've also seen the SDA program, and I've seen how the SDA design guidelines just became one day taken from the LHA guidelines, and I get a phone call saying you'll be happy with that. I said, why would we be happy with that? We don't have any money. We're running best practice guidelines for people to live in their place, to age in place, to have cradle to grave living was what we used to say. And we found that these SDA guidelines got developed without really any notification. So for that to be the beginning of the genesis of a massive program, I guess we look at the numbers that we've got today and wonder if we've succeeded after 6 years, nearly 6 years. I know livable housing has definitely been challenged by lack of market, take-up and the market failure. But I think that's a very strong sign of housing is going to change in this country. That is a basic right of people when they go to a new home, that those homes will be universally designed. One thing that also will change is by 2030 we start seeing a net carbon zero building code, which means every new home in Australia will be 6 or 7 star, which is really important. Look, I think CHPs, with that as the background, have done a pretty good job to take up livable housing. And I think if you look at cohorts in the community, in residential landscape of 10.6 million homes, they've taken up a fairly big percentage compared to everyone else, but still very low. Largely because they've inherited old stock, 40-year-old homes that are past their use-by date. They're not, they're 2-star. They're less than 2-star. And when you look at SDA, what we've inherited is 4,000 homes that are basic level. Now, these homes, when we look at the numbers, look like they are mostly less than 2-star energy. So starting off on the wrong foot, they're expensive to live in. So it's not surprising that the homes that we've given or that we've taken and tried to work with have been poor quality. But there is a sense across the country that all homes are. They're not going to meet net carbon zero by 2050. So there's 7 million homes in Australia, according to the federal government plan, that will not actually be changed by 2050. They'll still commit. They'll still put plenty of CO2 into the air, and we're quite challenging for us to reduce that or improve that target. Now, housing is 20% of emissions footprint in this country. So looking at what CHPs are doing in this space is looking to try and refresh that and really working towards improving the stock and doing that over a period of time. So CHPs have a long history of build to rent. In the last session, we're hearing about build to rent, and I was thinking about the history of that. I made a brief statement about that, and how that's happening and how that's coming on and what the history is. But having been there on that side of the fence, looking at that at that time and where it's going, I think there's no real great solutions coming at us. And one of the few of them is the Housing Australia Future Fund that the Shadow Minister has put out for this next election, which is really crucial. It's new housing. Now, coming back to disability housing, we have opportunities to see great outcomes by replenishing that 4,000 stock that sits out there that is old, and it's not universally designed. It's not energy efficient. It's hot in summer, it's cold in winter, it's expensive. But it is based on commuter routes. It's based on locations that are near services, near shops, healthcare, near jobs. So it's important that as we move forward, we start taking this next step to be able to replenish this. Not just because all the new homes in Australia are going to be sitting at a 6 to 7 star or universal design standard, because we know through COVID it creates better wellbeing. And from CHP's perspective, we've been doing this a long time. We've got 100,000 homes, a bit over that in the group. But we can do a lot more. And I think that's probably really the beginning of a broader, wider discussion, particularly on that livable stuff. I mean, 94% of homes, 94% of the 500,000 people in Ndis don't have SDA. And I just take a shout out to a mate of mine who at Christmas time, I had a phone call from my brother saying, this is the bed I built. What's the bed? Oh, it's a water bed. Where's that for? It's in his house, his family house that I knew hadn't been there for 25 years. What happened to him? He's got a nerve problem and he can't get out of bed and he's literally burning in his bed. Who's helping him? And no one can help him at the moment, except my brother building a waterbed that he can roll out of his bed into that waterbed. So I went and saw him and I said, what was this all about? How did this happen? He's like, I kicked a soccer ball just with the kids, you know. He's left his wife, who's in WA. He's now in Hobart. So, you know, this is a guy who used to play at the MCG for Melbourne and Hawthorn, and he has no idea what his future is right now. And I just think there's more got to be done. Sorry, good discussion we're having. Alecia, commend the work of Summer Foundation. Champions of change you are.
Thanks, Nick. Hopefully is yours working, Charles?
Maybe.
Oh,
yeah,
excellent. That's fantastic. Because thank you so much for that introduction, just to hear that, setting the scene of that broader picture around what's happening for community housing providers, taking it from SDA, but those other factors that are, you know, around the disability housing. So I wanted to throw to you next, Charles, just to ask you around, you know, you are a provider, so you're in this space, and if you could just talk a little bit about, from your perspective, you know, what's the approach that is being taken in the sector so far when you're seeing SDA being adopted and rolled out?
Thank you, Alecia, and I'll try and keep it brief because I could talk all day. As I think most people actually know me quite well. There's quite a lot of familiar faces here, and it's actually great to see you in 3D, not on a flat TV screen. So it's welcome, and thank you for making the effort of coming, particularly those who've come from North. It's been pretty trying up there. And right now I'm sitting on my phone, so if I get a message, we've evacuated a couple of our homes up at Ballina, so we're just waiting to see. The clients are fine, but they're all safe. So, but we'd like not our new homes to be flooded out. That would be certainly good. And I know our investors in the room as well, so he'd be very, very interested in that. Okay, so let's get on to SDA, or disability as a whole, what CHPs do. So we're really the landlord of last resort. So, you know, if they can't get into the private market, they come to us, either us at public housing or community housing. So we are dealing with people who are in desperate need, generally. They're on the priority waiting lists of social housing because these people are disabled. And if I just look over the last 10 years of our portfolio, disability people on the DSP who are now on our books have risen from 27% to 37% of our portfolio. It's going to keep going because we are the last resort, and they generally are the people that hit priority waiting lists. And I know my fellow colleagues are experiencing all the same thing. A little bit easier for us because we're slightly different as a CHP. We are a developer of housing, and so we build it, and that's what we do. And then we outsource tenancy management to other CHPs because they're better at than we are, and we're good at doing building. So we each have core skills, but we complement each other well. So for me, quality housing is the best investment or the biggest investment you can make in client care. Doesn't matter whether they're on the SDA front or just disability and they've got accessible housing. The difference that it makes to people's lives by having good housing reduces the overall cost on the exchequer when you look at care services. Because if the house works, you don't need to have so many people on shifts and all these other sort of things. So over the long term, it makes sense to invest in housing. Now, if I look at what we've been doing over the last 8 years, when we first built our first home back, completed in 2015, and I can actually see who was the recipient in this room who got it. It's at Springwood in New South Wales. The change that we've seen in what we've done in developing housing has been about building high quality housing that's durable, that will take punishment and will last for 30, 40, 50 years, and we continue to maintain it. That's been part of the problem with a lot of public housing. It hasn't been maintained. Whereas we as CHPs have obligations and standards and regulatory things that we have to meet to make sure our housing's maintained. It's interesting in our experience with the NDIS. Yes, it's easy to whinge about what's wrong, but there's also the fact is it's come into being. It's a federal program, so it's had its bumps as it's rolled out. Where we are today is, and I love the bit about confidence, it's an each-way bet on SDA at the moment because here is a market-driven provision of housing, but the pricing doesn't reflect the market. So house prices have risen, we all know, by 60-odd% over the last 4 or 5 years, which is great if you own a house. If you don't, it's pretty tough. However, The pricing on the NDIS price guide is most probably driven by CPI, about 15%. So we now have a huge dislocation in the cost of provision of housing versus what we get paid for the special accommodation payment. So it's now, investors on the price guide were originally promised an 11% return. I'm looking at doing a house and land deal for 2 robust people in Box Hill in Sydney. Okay, $1.25 million for the land before I even start on a 550 square metre block. Another $800,000 to build the appropriate robust home for these clients. What's the return to the investor after 20 years? Just over 5%. They're not going to play unless they have some mission-based ESG type funding where they can allow that to sort of come down to those low levels. So suddenly the market is now not at a price point that's going to work. So we have an organisation, the NDIS, who's not reflecting change that's happening. It's behind the game, and the price change is meant to happen 2023, so we will now delay another 12 months. I'll keep an eye on my time. So for me, in the business that we've changed our business a little bit, and we've gone from a B2B business with our CHP colleagues to also a B2C business, created a brand, Guide You Home, so we can deal with families directly for their children. We're just seeing heartbreak every day because we can't actually make the numbers work. We can build the housing, construction costs have risen, but we can't actually make the numbers work. And so this is the major challenge now, that we're going to sit around for maybe 12 months, or maybe we'll get 1 or 2 away, but it's nationwide. I mean, I was in Hobart yesterday. The price of housing in Hobart is it's staggering even by Sydney standards for the relative incomes that you have there. So there are some real challenges. But CHPs are really that logical partner, because one of the things that's really been missed by the NDIA is that CHPs have a multiple set of businesses. So they effectively, some of them are running, my colleague there from Evolve, they've got a real estate business. So they're providing real estate services into the market so they can provide rental housing back to clients that can afford to pay rental market prices. They have a social housing business where they're bringing clients in. They have a wide range of contact points. Now, the NDIS doesn't recognise that CHPs, which are nationwide, can actually provide the housing service for those 76,000 people to help them realise their goals. They mightn't individually be able to make that goal happen, but they'll know someone in the CHP land that could make that happen. And we can do it interstate. We can do it right across. There's just not enough education in housing, and it's a really complex journey. And I won't dwell on how complex it is, but those are the sort of things that CHPs can really bring to the party. And to me, it's really sad that the NDIA has not tapped into this magnificent resource that sits there and can be used very effectively, and they just need to pay for it, that's all.
Thanks, Charles. Passionate as always, which we all know. So we will get to the challenges, so you can go into it further, I'm sure, which is part of this conversation. We wanted to unpack that. But Wendy, do you want to add anything from your perspective around the approach that's being taken by the sector to SDA that you feel like you want to add?
No, but I do want to add something, Alecia, because we're having a conversation, so we're going to spark off each other, aren't we? I just want to come back to government funding, because we're going to probably get on to what's required, but there is funding out there. And so there is part of me thinking, what happened at the end of last year? We had a national disability strategy published. It does acknowledge that housing's needed. We've got a government funding stream there. We've got some idea about the people with disability there who need housing. And in the middle, we've got a housing strategy, haven't we? And I just think that there was a missing trick in this national disability strategy to say, okay, so why don't we try and match those two things up? Yes, we designed this scheme, but maybe it's time just to take a step back. It's not quite delivering what it was there to do. We've got this strategy. Let's develop with our sector with people with disability, a housing action plan that goes with that national disability strategy, that makes as good use as possible with the existing funding that is out there at the moment, and leverages, hopefully, that action plan, some more government funding to meet other needs of people with housing disability as well. Such a shame to see that strategy with nothing in terms of delivering better housing in it.
Absolutely, such a great point. Thanks, Wendy. And what about you, Nick? Do you have any other thoughts on this you want to add?
Yeah, lots.
Oh, you got lots. Is it dangerous me asking you? Sure.
Let's go to challenges.
Yeah, okay, let's get on to the challenges. Yeah, do you want to go with that?
Oh, okay.
Yeah.
Up first on challenges. I mean, I look at what we've done in the last period of things like the NHC, and I think, well, I've been in this sector for 6 years almost, and something like NHC has kind of just disappeared. At the same time as what SDA's been around, we've had NIFIC, I think 2018, and we've done an extraordinary amount with that. So from a Commonwealth government perspective, we can do a lot if we get champions involved. And I think with that, people like Nathan Dalbon and Marty Robinson going back to 2017-18 really took a concept that people came together and really took it, put it to life and moved it through Treasury. Now, it needed a minister to do that. And obviously it's been a great success. So I think with SDA in particular, there needs to be a bit of a change and a shift. And I think that's exactly what they've tried to do in the agency. I sit on the SDA reference group, we do, and can we talk about that? And we've got some others that are, yes, absolutely. And look, I think it's a progression. We have the minister meetings every 2 months, and it's been good to have the discussion. You know, we're a long way from moving that forward to where it needs to be. I mean, largely we've just counted the people that were previously, had housing from 2013 to 2016. The other thing there is what we count as younger people. It's about 2,900 places that are still sitting in aged care. So I think that's the right number. That's a significant number of people that have had no change in this time. And I just think, with the future going forward, we need to be focusing on actually looking at that particular. But the challenge is actually just getting people, getting momentum and getting a concept that will work. Wendy probably can talk to this, but there's concepts around equity. I mean, look at the National Affordable Housing Alliance and what they're looking at in equity and in equity, in financing. And, what we just heard from Sean, I think is just in the room in the back here. I think he's doing some good work, but I've never met you before, so hopefully that's correct. But it looked like you had the right sort of thought of what needs to happen. I think it's the bringing in of people with expertise into this group and creating that community of practice, which will eventually give us the concepts that champions like Richard Wynne, who unfortunately had a bit of a change of policy around him in the last few days, and clearly you can see there's a strength of opposition that can come from nowhere. To change the view of what should be the basic right and what we should be doing for people every day. Speaking of communities of practice, I'll say that Charles is the chair of our communities of practice. So, but I would like to hear from Wendy in terms of the equity, the Constellation project, what bringing people into this place will do if we can get that finance in and really looking at those concepts. But sorry if I'm taking you in that direction.
Thanks, Nick. I mean, one of the things that we've been advocating for, so we're getting a little bit into the general here and we'll bring it back. But, I mean, I suppose it's fair to say that people with disability are us, aren't they? I'm sitting here with my hearing aids in and no one knows that. Well, they do now. But, many of us in this room have a disability that's not particularly visible. So let's just, reckon there's a lot more than 30% of people with a disability or whatever. So I think it's great that there's SDA funding, but the work that we're doing is a funding model where the Commonwealth Government comes back, gets excited about solving social and affordable housing, gets excited about housing people with disability, so comes back. But the funding model we want is a funding model that can provide housing for anyone in Australia. Because let's face it, even if you don't have a disability now, when you get to my age and you get to be, in your 60s and 70s, you might have a disability, you might find a lot of the things that people with disability, with that label on, need now. So the funding model that we want, in which we've been working with institutional investors and with PwC and with the sector and with everyone, is a funding model that will fund anything. So it's a subsidy that meets the needs of the particular communities and where the housing's going to go. So I can do a bit of an advert for another session tomorrow, same time. Don't know whether it's the same place, but come and find out about the affordable housing boost. Charles is a great supporter as well, and as you know, if you've got Charles on board, it's going to be marketed. But that's taken as a bit of message, and I think we should bring it back to some of the retrofitting stuff that you were talking about, and maybe talk a bit about the building code, because that was an opportunity semi-taken, I think, wasn't it, to make sure that what we build now is going to last and be suitable for everyone.
I suppose I can talk a little bit about the building code, because it's when you're building these type of housing, and I don't want to preach to the converted, but you've got a multiplicity of different codes that you've got to meet, as well as the design guidelines, as which Nick was talking about, which were developed under the Liberal Housing. So the complexity of doing housing for specialist disability housing is complex, because you are building a house that initially is funded for the first 20 years at a higher level of payments, and then it drops. But that house could be lasting 60 years for those clients, because we've got lots of people who are 20 and in their 20s who are clients, and they're going to be around. That's their house for life. Some people call it forever home. So you're building a house that has to survive, adapt, and Nick's absolutely right. Get the right structure to make sure the heating and cooling, the impact, wire it. One of the lessons we learnt in doing housing was technology. Just make sure the house is wired, and the rest you can buy at Bunnings or somewhere like that, because basically once you've bought it, it's redundant, it'll change again. But things are evolving. I mean, I came out of the motor manufacturing business in terms of supplying parts, and people now walk around with exoskeletons manufacturing cars. Now, if they can get the battery weights right, people who are in wheelchairs will be able to jump into an exoskeleton and walk around, so they won't be in a wheelchair. So how do they come home? And they've got to be able to hang up the skeleton, and they've got to be able to get out of it and then proceed to be at their home. So you need to be future-proofing some of these things that go into design. But the challenge with the building code is just the sheer complexity of the number of things that you have to satisfy. Not only you need to find the right block of land, you've got all the various local council issues that also impact, and particularly if you're dealing for robust clients, often you need a bigger block of land, because they might have loud behaviours, they're noisy, there's a whole raft of different things that you need to adapt and bring into that particular type of design of the house. And the most important thing, and this is something that a lot of people forget, and some of the old basic homes is where you see a lot of this, is that these are homes, but they're also workplaces. So where you're giving care, you need to make sure that they function for both. So one of the things and we've most probably been the largest builder of disability in Australia over the last 3 or 4 years. One of the things that you've got to be really conscious of is, how do the people giving care want the house to work? So very much, this is why we've flipped the way we do the process. Know the client, know the person providing the care, how do you need it to work? Because that functionality is critical, because it does two things. Reduces maintenance costs, because the house is not getting banged up. It reduces vacancy risk, because the people like living in it. It's their home. And for the staff, they've got an easy place to work around. So that it's just not like build it, up it goes, and leave it. There's a lot of characteristics you need to bring into design, not only regulations, but how it actually works and the flow of that works. And as I said, you can build a heck of a lot of complexity in a house, but actually, as I said, if you can put it in with cheap stuff in the sense of a Bunnings material of technology that can be replaced, particularly as people go, it doesn't matter. It becomes disposable, that technology, because it's going to update. I mean, how many of you had Alexa or Google or whatever it was 10 years ago? It wasn't even there. Now our lives have completely changed. You could speak to Siri or whatever and tell her to go put the kettle on. So, all these things have changed, and it will continue to change as we go forward. And that's giving a lot of clients a lot of freedom, because they can actually see who comes to the front door now. The whole change of the way their lives works with technology is a significant change, and that's where you've got to think design for the long term.
Thank you, Charles. I'm going to ask you a bit of an audience question now. So we're getting quite a few coming through, so thank you for those. And everyone online as well, please remember you can also submit those. But there was a follow-up question for you here, Charles, around just what you said before about the role that CHPs could be playing within the sector. It could be much more within SDA, and I got a sense you were imploring the NDIA to consider that. I think the follow-up question is, are you implying that it should just be CHPs going forward that are those providers? Thank you.
I'm not necessarily saying it should be just CHPs, but what I'm saying is that when you pick up to talk to a tenancy manager or we actually now have created a new role, an SDA housing specialist. These people understand the needs and wants of what people actually need. And whenever you talk to a community housing tenancy manager, they understand housing. They are in the market every single day, and they are able to look at the different options that people are looking for, or network to other organisations to help do that, whether it's other support services, these sorts of things. So it's a resource that the NDIA has just missed, and it gives you nationwide coverage. So that's the answer.
Okay. Thank you for clarifying. That's wonderful. So we've got quite a few different questions here. So maybe we'll ask this to the panel, and whoever would like to pick up, please feel free to do it. But there's a great question here around the separation of housing and support. And we know how important that is for people with disability to have a landlord and then to have someone else who helps them with their support. So any views that you have around what's happening in the sector, or how CHPs can play a leading role in that?
I'm pretty passionate about this, and my view is there should be separation. We've seen in the Royal Commission a lot of pretty poor outcomes for people in terms of where you've got care and the management of the home. It provides a check and balance. And I first saw this when I was actually in the UK doing an investigatory tour of how they were managing operations over there. And the splitting of those services, I think, is really key, because two things. You're both aligned, firstly, in the sense that you don't want houses to be vacant. So you both have a financial interest in that. So there's an alignment there. You both have an interest that you want the care given to that client to be the best that it can possibly be. So someone needs to have that counterbalance of checking on each other. And that separation, to me, is really it should be done, and it should happen now, and it should be a pathway to make that happen over the next 5 years. So we have a managed way to actually make that happen, because if we don't, we'll still end up with the same muddled system that we have now, and I just don't think that was proven not to give great outcomes. It's not that people don't try. People often there are doing a really good job, but it's a way that Productivity Commission, when they first brought it out, said separate it, and I don't know why we haven't done it yet.
I might just add in that it is our core business to manage housing to thinking about it, and I'll evolve my thinking over the day, and as I said as this introduction, is that the thinking evolves, and it should do. But CHPs have been doing this for a long time, looking after people, looking after their cares, wraparound services, everything that comes with managing people. Build to rent here is relatively new. It's a thing that's starting to take hold. It's a buyer group. It's another demand opportunity. And you can package things in certain ways, but we've been doing it for a long time. I think the number Wendy was saying was about 30,000 of our tenants have a disability. We've been housing people in this space for a long time, so we've got core competency to be able to carry that across. And that's where SDA has probably been an area where we've moved into as CHPs and just done what we've been doing, really. And in some of those cases, transitioning people out of existing situations. CHPs, they look to be about 1 in 5 of all the homes. There's about 6,000 dwellings. We have about 1 in 5 by the look of that. And that's in PowerHousing's group. So it's a little bit larger than that, possibly. But getting the data is really quite crucial to that, and getting an understanding of that. But I think Charles, you summed that up very well in terms of there does need to be structure there. There needs to be continuing evolution of that. And the role of the CHP has been vital for some time. It's about, taking it forward and in this next phase, working with that to get the residual amount. I mean, we've 16,789. I think it's about 17,000 is the total number, of course, in the latest numbers of tenants that are enrolled. So there's still another 10,000 out there. Yeah, 9 to 10,000. I mean, you go to 30,000 in the number, and no one in honesty knows what the number is. It's somewhere between 26 and probably 40,000. So, it just needs people. When I said champions before, people like these two here alongside me and Alecia, people that have this national voice, and everyone in this room contributing towards that and getting our national decision makers to take the step to do what we need to do. So.
Can I go old school? Because I'm neurodiverse and I'm not good with technology. That's my first point. Because one of the other previous sessions, I had to deal with a lot of outside noise. It wasn't a good space to listen. That's why I was doing this in a lot of the sessions of putting earphones on. But your points are great, but it's the tradespeople who build who are not building to really good skill levels, because I've moved into a new place. It's not ideal, right? But I don't qualify for housing because I appear normal, right? But I still haven't got my report that's been paid for or have they read the reports? This is NDIS, not NDIA. So there is a lack of training. I think that has to work hand in hand. And lived experience has to be part of that design process from the beginning, because it's happening too late. That's all I want to say.
Thank you so much for your contribution. Do you mind if I summarise it for the people that are watching, or would you like to use it? Yes, okay, thank you. I took on board what you said about the technology. So really, a person in the room with lived experience is just so vital, and having those voices is so important. But some of the comments you made then around the design needs to be quality and meet your needs, but have you part of that to start with? And also just some challenges around being an NDIS participant and the reports that you're putting in and getting those processes completed. Is that fair to say? Is that correct? Thank you so much for sharing that. And I think that really echoes a lot of what we hear from people, but also, some of the challenges that providers have said to us as well. So it's really fantastic to have your contribution and voice. Thank you.
If I could just answer that a little bit more for you. That's why we changed our whole business model. And we started with the client first. So to understand what your needs are, that's why we have a housing specialist. They're highly trained. They listen to it. Then we link with the support coordinators, the occupational therapists, make sure those reports are of a high standard. Over the last 3 to 4 years, we start to know the people who can write proper reports, because there is a varying standard across the industry, and that's a very big problem for participants. So your story is very familiar. And that's why the process is not well funded at the front end, in the way that housing's put into plans, the way that they deal with organisations like us, because we're effectively self-funding that. We don't get paid anything for that. The only time we get paid is when somebody moves into a house and is paying rent. Now, that's a 2-year journey. And this is what's not understood. The first part is to get the plan right. The second part is then to be able to buy the block of land. The third part is to get the DA on the housing. To construct the house is actually the easiest bit, relatively speaking. And then we're handing the keys over and making sure that there's an ongoing continuity for what you're saying. The point that you also made is the quality of the build. That's critical as well, and how that's done. So that's part of an expertise that we've gained over the last 6 or 7 years in learning how to build this sort of thing. That's why my comment was, it's a home for people like you, but it's also a workplace. So you need to make sure how things work. And that's about getting the design, bespoke design up front, and can be done. Yeah.
Can I just add something else as well? I mean, one of the things that Charles has said is that he's chairs this NDIS group, Communities of Practice. So what I think is recognised in the sector is, yes, many people have housed people with disability, but not everyone needs particularly specialist adapted accommodation. Those organisations that decide to be registered as specialist disability accommodation recognise, as Charles have recognised, that it's just not like, building just anything. anything needs to be built well, by the way. But there's an extra step here. And so I think when we've got champions like Charles that take on that extra role to ensure the rest of the sector comes along as well, it's great. And he's not the only one, by the way. There's a few in this room.
I'll just conclude that by saying there's 10.6 million homes in this country. There's 2,000 that are purpose-built.
Yeah. It's part of the issue. Thank you so much. And just a practical piece from me, I just wanted to mention an invitation if you'd like. There are, at the Housing Hub stall, one of our occupational therapists is actually here today. If you wanted to talk to her about anything to do with it, you're welcome to. Yeah, that's what they do every day, is supporting people like you with those sort of challenges. And so we'll just go on to the next question because it leads on so well from what you've just said. And it is about how we are seeing so many completed SDA dwellings that are just sitting empty, and we can definitely see that in the numbers, and I'm sure people here are feeling that in your business. And so just a question around, what's happening around tenant identification. So identifying those 30,000 people, but then the people who are identified and applying for SDA funding then being knocked back or having to submit extra reports and evidence or going through long, drawn-out processes. There's a variety of things that are going on, and now that's culminating in so many people at the Administrative Appeals Tribunal. So the person who's asking these questions obviously got some experience in this, and just asking us about what are some of the conversations, whether that be at the SDA reference group, which unfortunately we're not allowed to talk about due to confidentiality, but perhaps if we are aware, I'm happy to talk about what Summer Foundation is doing to work with the Minister and the NDIA, but I'll give others the opportunity first if anyone wants to talk about lived experience for yourself in your business or the work you're doing.
I'll just give you a good example of what's happened to us. So, as I just told you, there's a long journey in putting a development together. And I'll be quite blunt about this to the NDIA effectively, is that they changed a policy rather by stealth. And Alecia's been polite about that, but it was effectively by stealth of saying that if you want your own single unit, high physical support, or you can't have it, you've got to go and share. Now, particularly in the robust area, that's not practical for a lot of our clients. They cannot share. And I've got one particular client in Queensland who has to be chemically restrained until we can build him the appropriate house. Now, those practices are meant to be gone, but it's a real struggle to try and get the appropriate outcome. But we've built in Queensland a fantastic building for people who want to live on their own. And the government then penalises us, or the NDIA, that we can't get clients now for it. So that impact for investors is pretty shocking, because suddenly the whole risk profile of the industry has changed by someone putting a policy in, and I call it a discriminatory policy, because we're meant to give clients choice and control, and then we chop them off at the legs. And the more I've seen it, the more I suppose pretty angry about it, really. But for me, it's the longer term thing. They wanted private capital to come into the sector. You cannot change the rules just because you feel like it and not tell anyone. That is going to undermine confidence in the sector for investment. There is I use the word boatload, it's much more appropriate with floods going on. The money out there is flooding like the stuff we're seeing in Queensland. There is a lot of money, and I've got people I know here in the investment community. There is a lot of capital out there that would like to deploy in the sector, but it's the complexity and the fact that they've changed the returns and the way that capital can be deployed into what type of housing is making it very, very difficult. And if you looked at the original price guide in 2017, I think we were meant to have built 10,000 homes by now. We're lucky to have got a couple of thousand, because of the practices that are going on. And they talk about saving money. Well, quality housing in the long run will save them the care money in the long run. The NDIS is going to be around for, we'll be all in the grave by the time, it's got longevity, because it's very hard to unwind, because every state, every territory and the federal government would have to agree to collapse the scheme. I don't think that's going to be easy to achieve. It's bad enough to try and get them all to agree in the first place. So I think that we have to be vocal in what we were trying to do for our very disadvantaged Australians. We are a very rich country, and we can't even fund a scheme and get the scheme operating effectively. In fact, I think I read in the numbers the NDIA is spending more on legal costs than they are on housing costs. It's bizarre, especially the administrative tribunal that you have to spend getting clients. And I'll steal a little bit of Alicia's thunder here, but the majority of decisions that go to, I think, correct me if I'm wrong, that go to the administrative tribunal and get through there, so the NDIA's decisions are overturned in the advantage of the client, what they wanted originally. So it seems all a bit pointless to me.
Thanks, Charles. I'm happy to talk a bit about if that's helpful to answer the question. Certainly some of the work we're doing through these surveys and research is a great way that you can express your views, and it's been our approach to work with the Minister, Linda Reynolds, when she came in, to be able to provide the information and evidence of what's happening in the sector. What are we hearing from providers? So support providers as well as housing providers are also really finding some challenges. So those reports we can then present to the Minister, and she has held a number of roundtable meetings with the sector, which lots of different providers have been part of, including our community sector here, to listen to some of those concerns. And so for us, what we really need to see now is what are the actions we're going to take to change some of those things. So from the work that we do at Summer Foundation, we do have a tenancy matching service, which is what I was saying, some of the staff are here today at a stand, but they support people to get SDA funding in their plans and have helped 650 people so far. But right now we have over 100 people that we're supporting through the administrative appeals tribunals and those reviews. And it's a significant amount of people, and it's really challenging for those people with disability. But what we have to remember is that there is legislation and there's SDA rules, and those rules say who is eligible. That's what we have to go with, and that is what we're going with. And Charles is right. So far, there's a lot of us working together. It's not just people coming through our service. There's excellent support coordinators, excellent occupational therapists. They're appearing at hearings and giving evidence. And what we want at the end of the day is people who are eligible. We don't want to mislead people who are not in the 6%. We want to make sure people who are eligible get the right information and get the right support to get those outcomes. And we are seeing that everyone who's gone forward and wanted to do that, not everyone wants to fight the NDIA. That's a really intimidating thing to have to face. But the people who have gone there with the support of lawyers, and I know some of the housing providers are now having to fund that themselves, or the investors, but that's because it's the right thing to do for people's rights, and we can make sure people get the funding that they need. And those people have been successful so far. So sometimes it will be settled through the case conference process. Sometimes people will get it through the first review. They just had to clarify something a bit further. That some people are having to go to hearings. And, if you are interested in that, you can read about the hearings that they're published, and those, you can read what the members are saying at the AAT about their interpretation of whether that's people's rights under the UN Convention, whether that's under the Act, and how that all fits together in terms of people and what they need. But by far and away, this issue is around people wanting to live alone as one of the main areas that people are having to appeal, just to clarify that. I can see someone at the back with your hand up. Do you want to say something?
Oh, yeah. Just ask a question.
Sure.
Yeah, sorry. Just a question, maybe for you, Wendy. I just want to change tack a little bit here, but one of the issues here gets a bit of a bashing, fair enough, because I work on a number of those appeals and things like that. But what I just want to change tack around is incentives and talking about cash flow and funding that needs to go out and using what's out there to build. The ATO seems to not really come under scrutiny for what they're doing in terms of SDA. And, if I look at the community housing sector, social and affordable housing, for example, benefits from GST breaks in terms of developing that stuff, and CHPs can benefit from that. SDA at the moment does not, and it is tricky to navigate that. But when you were talking, Charles, about setting the house up for care, well, the ATO has taken a view that it's not any different to a normal residential house. And I'm just wondering, in terms of the community, from CHIA's perspective, in particular as the body for community housing providers, what's been done to sort of lobby the ATO to sort of get SDA on the same footing as social and affordable housing, so that we can, get on the same footing as aged care and social, those types of investments from an institutional level, because I don't need to tell everybody in the room that's one of the biggest problems at the moment. So I just wanted to know, well, lobbying, we're obviously doing parts in other parts of the sector, but it'd be good to know what CHPs can do, given they have experience of already doing that with social and affordable housing in particular.
Sure. Yeah, sorry. Where are you from?
Oh, Holding Redley, sorry.
Holding Redley, thank you. Yep. I just will summarise that, if I will, just for the people who are watching remotely. So really the question is around, for the community housing sector peaks, what are we doing to make sure community housing sector and SDA is getting the same sort of tax incentives as some of the other types of housing that exist? Is that a fair representation? Excellent, thank you.
I'd like to answer that pretty quickly. Is get a phone call from Charles about 3 years ago, and the phone call is, you know, they've got investment coming through. They're not sure whether GST applies or doesn't apply. Do you remember this, Charles?
Yeah, I do.
Yep. So we sorted out the top 3 lawyers in tax. One of them started and finished their degree in 1999, has worked through tax ever since as a partner of a large firm. One of 3 people that can give you an answer, that can write a letter to Minister Fletcher. 2 weeks later, you got clarification, no GST applies. Now, there are still concessions. There are some concessions that apply, and you're aware of those. But it's about, I guess the answer is about how do you actually get people activated to do those type of things, to get that outcome. Because it takes people, I suppose, is the quick answer.
Okay, great, thank you. All right, so just coming back to some of the questions that we've got on here. So we've got a question about tenants again. So starting to think about people with a disability who might be waiting for access to housing and wanting to live in social or community housing. How do we find out information about people and their needs? I guess if we're a housing provider and people are on the waiting list, I'm not sure about that. I'm not sure if that's something that you can shed light on for us as well.
I mean, it's something that we've spoken about. There's that market stewardship role as well, isn't it? Because I guess not everyone is going to be eligible necessarily for social housing or be in a position to go on the waiting list. I just think if we go back to that figure up there, those 76,000 people who have housing in their plan are in unsuitable or unaffordable housing. So what happens next to them? So we're not talking about SDA here, we're talking about people who need housing but are not eligible for SDA. So what help and assistance do those people get? And so one of the ideas that we've had is that those people, you know, as a sector, we do understand housing. We've mentioned Evolve. There's plenty of other organisations that run real estate, not-for-profit real estate agencies as well. So we don't just understand our own housing, but we understand how people can get access to housing. Isn't there a role for the sector to work with the NDIA to assist those 76,000, even if we can't provide them, and we can't at the moment with social and affordable housing? At least we can help them access potentially those options that are available for them. The other benefit of that is we get to understand who these people are and what they want. And when we do get the funding to build more social and affordable housing, we'll be in a far better position to build what we need for those people where they need it as well. So I think that's where we've got to move, not getting people onto a waiting list they're going to wait for ages on at the moment, but to understand their needs, find out what options are best for them, make those linkages. So, yeah, that's what I reckon we should be doing.
And there's quite a few questions coming up around this sort of emerging theme. So there's a theme around what about, again, the people who don't qualify for SDA but need affordable housing that's accessible. So we just heard about how do we find out what they need, but also how do those people get access to the resources they need for home ownership? But then also there's a question from someone in the room who's a funder of specialist disability accommodation. Having funded that, now how do we start to fund, and what are the emerging things we could fund to support those people as well? So I know that's a few questions in one, but there's a theme there about where would we see this heading for people that aren't going to be eligible for SDA, and what are some of those models that you're seeing?
That's a big question because it's extremely challenging. The problem that we face is, and it comes back to this thing that we have to address nationally. If you're going to put subsidised housing on the ground, you need to make a subsidy happen. Now, if we just take and there's this continual kicking of the football between state and federal. Well, they're both responsible, and you know, I wish the politicians would just grow up a bit and recognise that they both have responsibilities for it, because effectively, if you look post-war, there was something like 700,000 homes built under the various Commonwealth schemes funded through the states. A fair chunk of that was sold off, and we've now got a residual 400,000. it would have never happened. And whether it's homelessness, it's all these different cohorts that need to be housed. You go to the UK, 20% of the housing stock is effectively run by housing associations or community housing providers. So there's an inherent ballast within the housing market. And whilst politically it's hard because there are 7 million or 10 million housing owners who vote and will look at their interests and like housing prices rising, I think as a responsible society we should be looking at the bottom 20% of people where we need to actually spend our dollars, not on first home grants and all these sorts of things. They don't actually add a lot of value, whereas if we dealt with the bottom 20% by providing enough continuous money in, we as CHPs will build it. That's not the problem. We can do all that sort of thing and we'll build it appropriate housing and take that care and wraparound services that need to happen, because we do that every day. But unless we're prepared to put a bit of money towards it, we fail as a society and that's why you have particularly people with mental health issues. It's become the fastest growing sector is single older women. So we're just going to throw them on the shelf and on the streets. These are the situations that we're in a federal election. These are really key things that we need to be looking at and addressing. No matter what stripe of party that you're in, it's really about what are we as a society.
So can I say what we should do? So moving on from that, just remember that session tomorrow where we talk about the boost. We're boosting the boost, so that's that. Yeah, well, we just keep mentioning it. I don't mind how many times you mention it because that will solve a lot of the problems we've got today. I mean, we talked about a lot of different things, so I do think we need that strategy to have a plan for housing in it as well, because these things have all got to work together, because we talked about market stewardship, we talked about improving building standards, haven't we? We've talked about making sure that tenancy management is separate from report support. We talked about needing better information and everything. You know, one of the better information things that would be great, and I mean this is betraying my UK heritage, is we started doing accessible housing registers. So it's not a waiting list, but it's a list of homes, not just the ones that are built for people with disability, but the other ones that are either adaptable or adapted and useful. So we get a better handle over what supply is out there, not just the new supply, but the existing supply, so that we can provide better information out there to people who are on the waiting list or whatever, to understand whether that accommodation could be adapted very easily. And the third thing I'd love is a proper way to fund adaptations as well, instead of, you know, we're talking about arguments between the states and the Commonwealth, but there's also arguments between us as a sector that provides services and some of the people we're housing, because of this difficulty of funding those adaptations from rents. It just doesn't work, and so we need a proper service there.
All good. Okay, I've got time for one more question, I think, before we have closing thoughts. So it's gone really fast and there's been amazing questions here. But there is a great question that's been raised about, there's a lot of tenants who are living in basic or existing, but particularly the basic. You know, what can we do to be able to support these people to move into the other types of SDA, which would better meet their needs? So I think it's a fantastic question and something we're grappling with at Summer. So happy to answer it as well if you like.
Knock them down and rebuild them would be the start. The thing that I think is the theme, and usually I look to experts of the people in this room and the people around me, we look to try and convince decision makers and thought leaders of how to move from where we are in one problem to the next. And I think the problem that we're looking at here needs a really categorical smoking gun. Sorry if that's a bad analogy, but to something that's quite clear that you can see the cause and the effect. And I think in housing, if you live through lockdowns, and particularly in this part of the world, why it's probably so surprising we're actually here in Melbourne, is people spent over 200 days, they spent longer than that. And they realised how those homes performed. And again, as I say, hot, cold, all those things that, you know, expensive to heat. They used them not just to sleep in, come home at the end of a day of commute. They used them for other things, which was schooling. They did it, you know, it wasn't for the home. We wouldn't have an economy. Wouldn't just have a health crisis, we'd be down the gurgler because no one would have had a job. So we're thankful that those homes were there, and I think there's a mindset, hopefully, that we see at this future period where people start to recognise that healthy communities start with a home. And if you've got a home, you're lucky. You know, there are people that don't. But look at those homes, how they function, then start bringing it into a focus, which this is the primary policy where there should be the beachhead secured to move forward and progress, really, is to look at what's the way these homes perform and replace them. And it's a simple thing. There is funding to do that. Obviously, the incentives are there. Home prices have risen in 2021 alone by up to 40%. You go to now and you find a 39% increase in 1 year. So it's challenging. This part of the world's been a little bit let off the hook a bit, but New South Wales has been catastrophic, the price rises, and how do you create those? Well, the value is in the land. The land's already there. It's already got homes on it. And that's where there's a lot of people that'll be around the conference wanting to give you their card. Say, you know, have you got land? Can we do something with it? I think there's going to be an evolution of that into something more serious, more structured, like a NIFIC that Wendy is talking about, and someone like Charles is going to mobilise it. And that's how the outcomes will come, in my view.
Thanks, Nick. Just to take a little bit, sort of add to Nick's comments there. So for me, it starts at the client. How many thousand did we say there? 14? Or 6,000? Whatever. So let's get the clients and let's get their plans sorted out. That's number one. So that's why we start at there, because whilst some of these old homes could be 5-bedroom group homes or whatever, they don't necessarily want to live in the same home. They may want a 2-bedroom. They may want the variety could be completely different. So let's understand what the client wants, the choice, work on that plan. Now, the big thing is we need to get the process. It's the process in the NDIA that needs to be fixed, because it takes on average 6 months for a plan to be approved. It's just too long. As I mentioned before, you've got this whole timeline. There needs to be resources devoted to shift this cohort and shift it a lot faster. Then we can either knock down, rebuild the same one, or we'll build where people want to live. The money will come in from our financiers that can put those packages together. So just in the largest transaction we did in New South Wales, we were able to bring together 170 million to actually finance the 300 odd places and shift people into completely new housing. So all these bits of the jigsaw can happen, but the key thing is the start of that process. And if we get that right and can do it on scale, I come from originally manufacturing, so I'd like to cookie cutter to get the NDIA to actually work a whole lot more efficiently in decision making, and then we work on the part that they really clients need is a new home. And we could do that pretty quickly, because we built the 330 places in 18 months. So it can be done. We did this all over the whole state of New South Wales. So right people, right constituents who bring the funding and understand that things will change on the fly. We need to work through those processes. Councils work with all that, then you can make it all happen. So that will deal with the basics.
Great, Charles. I agree. I think it starts with the people. And I just wanted to say, if you're sitting there, whoever's asked this question, and you've got people that you know, you've got tenants that are living in basic and you want to work with them to work out what they need, there's a housing needs and preferences resource tool that you can use on our website, on the Housing Hub, but also on Summer Foundation. You can print that out and use it and support people to have those conversations and really understand their options. So that would be what I would say. There's lots of videos and things that you can use as well. And I think it's fantastic that people are thinking that way. So great work on that question. It's exactly the sort of thing we want to see. So we're running out of time. So I'm just going to ask each person now, very quickly, 30 seconds. What would be your top 3 things you want to leave us with that you think that we could have impact to really make the sector flourish as we leave the room? So, yeah.
So my 30 seconds will be 45. But anyway, while we've talked about the problems, I want to talk just to leave you with the stories that have made a difference in people's lives. So I've seen people speak for the first time in 30 years. And the words they said, new home, new home. And, that's quite astounding when people take their first view at their new home. I've seen a person get out of a wheelchair and go and close the door in their bedroom. They'd never got out of the chair before. I've seen people now looking after their chickens and having their coops and having an interaction and a quality of life that they never had before. I have a client that we have, her name is Kate. she's Aboriginal, and for the first time she's connecting with her heritage and her family. So for me, there is a lot of good that's happened already. And I just want to make sure that even though we've got some battles, the change that we make in people's lives, it's not dollars and cents. It's often intangible, but it's a quality of life for them. And we should not forget why we're here.
I'll try and take 15 seconds to make up for that now. I'm just going to say we need that strategy. We need that action plan. We need the boost tomorrow, Thursday, same time, okay, probably in this vicinity. And I think that market stewardship role would be good as well to help people access good housing.
Probably get up out of bed every day, keep doing what we're doing, and just keep building the momentum of what's happening here, because in 5 years from now the sector will be totally different for those that are in the sector, for those that are partners of the sector, and for those that have a strong interest. Keep raising the flag. Second thing is that national plan and working towards that equity and bringing those investment pools together. Governments react to that pretty quickly. And third, go to Housing Hub.
Nice one, thanks for that. I just want to say, please join me in thanking our amazing panellists. So Charles, Wendy and Nick. It has been a big piece of work that we've worked on together to make sure that we got the survey right, we got it out to the members, and we thank everyone who contributed to that as well. I'm sure I know there's people in the room who did, and we will be releasing that for everyone to have access to shortly. So make sure you look out for that, and thank you so much for coming and for all the conversation and the questions today, and hope you have a great conference. Thank you.